Hi, my name is Shakura Shao, and I will be discussing prenatal health counseling and schizophrenia. Schizophrenia can be classified as a neuropsychiatric disorder. Individuals with this disorder may struggle with the way they think, behave, and feel. It has been found that prenatal exposure to infections such as influenza can be associated with an increased risk of neuropsychiatric disorders. The research question The research questions if there are strategies to enhance immune function in expecting mothers to prevent schizophrenia. The research hypothesizes that women who receive counseling before conception throughout their prenatal and their postnatal period are least likely to have offspring that develop schizophrenia in comparison to women that do not receive counseling before conception. An experimental design will be used to gather data for this study. The study will be conducted over a course of 20 plus years, making it a longitudinal study. The study seeks to find if counseling, which is viewed as the independent variable, has an effect on the dependent variable, which can be viewed as schizophrenia developing in the offspring. The proposed study will consist of 30 female participants ranging from the ages of 25 to 35. 15 women that are trying to conceive will be selected to receive counseling before conception, during their prenatal phase, and during the postnatal phase. The second group of 15 female participants will have conceived already and will be between 14 to 15 weeks pregnant. Each parent will be asked to complete the positive and negative syndrome scale until the child is of age to complete the questionnaire themselves. The positive and negative syndrome scale is a medical scale that is used for measuring schizophrenic symptoms. There are 30 items on the scale. The participants must select 1 through 7, 1 being absent and 7 being extreme. Each participant will be required to sign a consent form and will be required to attend counseling sessions monthly as a group. Each participant will be able to stop counseling after their child is 8 weeks old. Parents are required to monitor their child's behavior so that they are able to report their child's progression of behavior accurately. Every 7 to 10 years, each offspring of the participant will be asked to come in to receive an MRI. Each MRI will be conducted at Sentara Health Center located in Hampton, Virginia. The non-contrast T1 MRI will be used to view any changes of the brain or abnormalities in the brain. Non-contrast T1 MRI provides good contrast between gray matter and white matter. This will be beneficial due to a symptom of neurological disorders such as schizophrenia is the damage of white matter in the brain. The use of non-contrast MRIs will allow a detailed image of the brain. The results from the 15 women that were actively trying to conceive and the results from the women that had already conceived will be compared. The results from the study will determine if counseling before conception on immune health is a positive preventative strategy when it comes to the offspring developing schizophrenia. Research that was previously conducted suggests that the immune health of the mother can cause schizophrenia in the offspring. It can be concluded that further research should look into early preventative strategies of infection during prenatal care that include mothers that have already exposed the fetus to infection. Thank you so much for tuning in on my discussion on prenatal health and schizophrenia. Make sure to subscribe.